involved, and I'm coming in loud and clear. I have the delight of introducing both of our speakers this morning that are joining us from the East Coast. I've got Victoria Kluge, who's an emergency program administrator with the City of Atlanta Department of Aviation, where she supports emergency preparedness, planning, training, and emergency operations center operations at one of the world's busiest airports. And then also I have Larisa Tomassoni, who's a public health strategist and management consultant who specializes in strategic planning, organizational development, process improvement, and resource allocation for complex health systems. She works with healthcare organizations, public health agencies, and nonprofits. So we have two presentations to share with you today, and Victoria is going to be the first one. But before I turn the microphone over to her figuratively, a little bit of housekeeping reminder to everybody. If you haven't joined us before, we've got the chat. It's active. Please feel free to chat amongst yourselves in there throughout the presentation. But if you have any questions that you'd like our speakers to address, please make sure that you put those into the Q&A. I'm going to be monitoring that throughout, and we'll do our best to take up those questions at the end of both presentations. So again, use that Q&A to direct your questions to our speakers. Otherwise, chat away in the open chat field. And Victoria, now I get to turn it over to you. So looking forward to hearing your presentation. I think you're still muted, and I know we're just taking a second also to share screen, so everybody stand by because it's three different presenters ultimately having to share their screen.
Can you hear me now?
Yes, we can hear you. Perfect.
Okay, perfect. Awesome. All right, let me go ahead and share my screen. All right. All right, so good afternoon. Again, as Misha said, I'm Victoria Kluge. I'm with the Atlanta Airport, the busiest airport in the world still. Dubai's catching up, but we're not there yet. And thank you for the opportunity to contribute to this discussion on emergency management and healthcare. Today, I want to focus on how we design exercises for high-volume systems, systems that cannot pause operations in order to respond. I'll briefly use major hub airports as a comparative case study, not because healthcare should model aviation, but because both environments operate under the same constraint, continuous throughput under stress. So let me begin by grounding us in what that reality looks like. High volume systems do not get the luxury of stopping. Patients continue arriving, flights continue landing, staff are already operating near capacity. So emergencies occur on top of normal operations, not instead of them. Small disruptions cascade quickly. A minor delay in triage affects inpatient flow. A delayed aircraft departure ripples across national network, and leadership decisions determine whether the system stabilizes or erodes. So with that context, it's important to examine why many traditional exercises fail to capture this dynamic. The traditional exercises often focus on the story of the event rather than the behavior of the system. They emphasize the first operational period instead of sustained strain. They provide clarity where ambiguity would normally exist, and they rarely simulate fatigue or decision overload. So high volume systems rarely fail in the first hour. They actually degrade over time. And to understand why, we need to clearly define what makes a system high volume. So high volume operations are defined by continuous throughput. Patients, passengers, staff, data, they are tightly interconnected, meaning that stress in one area propagates quickly. Resources will scale slowly, and there is minimal tolerance for delay. The defining characteristic is interdependence, and that interdependence produces shared stressors across sectors. So hospitals and airports share remarkably similar stressors: staffing constraints under surge, limited physical space, heavy reliance on information systems, and intense public visibility. Additionally, both depend on partners outside of their direct control, whether it's emergency medical services, public health, suppliers, airlines, federal agencies, and those interdependencies complicate response and recovery. So given these realities, we have to rethink what exercises are actually meant to accomplish. The purpose of an exercise is not actually to validate that a plan exists. And it's not to test whether individuals remember procedures. It is to evaluate the operational resilience and adaptive capacity. So can leadership reprioritize under pressure? Can coordination structures scale? Can the system continue operating while it's degraded? And to do that effectively, we rely on 3 core design principles. So in aviation, success is measured in passengers per hour. You all see the flights coming through, and we consider a smooth operation, all of our flights leaving on time, all of our passengers happy. In healthcare, it's patients per hour. Tactical correctness does not equal operational success, and I cannot stress that enough. Exercises should force decisions that directly impact flow, diversion, surge expansion, reallocation of staff. And when throughput degrades, the system destabilizes. And that's actually what we're trying to test. But throughput is only stressed when friction is present. So real crises are defined by constraints, not spectacle. You should not be introducing theatrics into your exercise. Incremental staffing degradation, delayed or distorted information, competing departmental priorities, resource allocation conflicts, those should be your main focuses, not putting on a well-rehearsed exercise. These friction points create decision pressure. Exercises that rely on dramatic but unrealistic injects miss the operational tension that leaders actually face. And that tension increases exponentially when decisions begin to stack. So systems begin to stall when leaders become overloaded. And effective exercises increase decision frequency. They layer operational challenges. They force delegation and risk acceptance. This reveals whether the command structure truly functions under load or whether everything bottlenecks at the top. So to simulate that realistically, we must extend exercises beyond initial response. So most structural weaknesses appear in the second or third operational period, not the first that everybody always focuses on when they're testing in an exercise. So exercises should model extended operational windows. They should incorporate fatigue, resource depletion, and recovery tension. Sustained strain, not the triggering event, is what exposes fragility. And to make this scalable, I recommend a modular design. So module 1 introduces that baseline surge, elevated volume within capacity. Module 2 adds compounding disruption, resource degradation and inefficiencies, patient surges, or for us, passenger surges. Module 3 stresses sustained operations and recovery. This is where you get into policy trade-offs, prioritization, normalization. And this mirrors how real-world events actually unfold. So let me illustrate that with a practical aviation example. We have at the airport what we call IROPS, or irregular operations. And irregular operations follow a predictable 3-part pattern. So in this case, we'll look at in that modular system. Module 1 is the disruption. A trigger, often weather, causes delays. Passenger volume accumulates, staffing and gate capacity remain fixed. Module 2 is escalation. Delays cascade across the network, congestion increases, external pressure intensifies. Module 3 is stabilization and recovery. Leaders are reallocating limited resources, multi-agency coordination becomes critical, throughput gradually stabilizes. So the airport never stops operating. We will always continue operating. We're a 24-hour operation, but it will continue while degraded. So when we translate that model into healthcare, we have clear parallels. In this particular case, passengers become patients, gates become beds, checkpoints become triage, and operation centers become hospital incident command. So the terminology changes, but the system dynamics do not. So what does this look like in a healthcare-specific inject design? Rather than stating that a mass casualty occurs, we introduce constraints. So that can be a 20% volume increase during peak hours. Radiology turnaround time degrades. Staff absenteeism increases. And leadership must decide whether to divert, expand, or operate under degraded standards. The objective is not a correct answer. It's never a correct answer. The objective is to have it as disciplined prioritization under pressure. And to evaluate that, we must measure the right variables. So binary outcomes are insufficient. We don't check boxes stating yes or no, we succeeded, we failed. It's tracking decision latency. It's tracking throughput variance. It's tracking speed of resource reallocation, identifying coordination breakdown points, and measuring time to stabilization. Again, high volume systems rarely fail outright. They erode gradually. So after the exercise, the analysis needs to reflect that reality. And Larisa is going to go into this a little bit more, but just to give you an idea, after action reviews should examine the structural bottlenecks, policy conflicts, staffing model limitations, information flow delays, and leadership bandwidth. Individual performance is rarely the root cause. It's never a single point of failure during any sort of system degradation. Structural constraints are what actually drive the outcomes. So as healthcare systems continue operating closer to capacity, this analysis becomes even more critical. So capacity margins are shrinking, operational complexity is increasing, public expectations are higher, especially post-COVID, and interdependencies are deeper. Exercises that fail to model sustained strain risk creating overconfidence rather than resilience. We don't want an exercise that does a lot of hand waving over here saying, yes, we have a plan and we know it works. You need to actually test those constraints to make sure that that plan will carry you through. So that brings me to the final takeaways. If I leave you with 6 principles, I hope they're these. Design around flow, not narrative. Stress the system under sustained load. Build realistic friction into the environment. Test decision saturation and leadership bandwidth. Measure resilience through meaningful metrics. And treat exercises as operational laboratories for adaptation. High volume systems cannot eliminate stress, but they can improve how they absorb it. So well-designed exercises will provide one of the few safe environments where leaders can explore difficult trade-offs before they must make them in real time. And with that, I will introduce Ms. Larisa Tomassoni. She's going to talk a bit more in depth about those after-action implementations as well as operational resilience.
Awesome. Now we do the slide sharing transition. I'll update again to anybody in attendance as you have questions as we go along, throw those into the Q&A and we'll get to them at the end. So far everyone's been pretty quiet, but we'll look forward to seeing some feedback after our next speaker.
Thank you, Misha, and thank you, Victoria. Hold on one second while I share my screen. Great. All right, thank you for kicking us off, Victoria. Good morning, good afternoon, and good evening, everyone, and thank you for the opportunity to participate in this discussion. As Misha mentioned, my name is Larisa Tomassoni, and I'm a strategy and operations consultant and public health specialist based in the US. My work focuses on translating strategy into operational improvements and governance structures that enable effective program management and service delivery. I'm excited to speak with you all today about how exercise design can support infrastructure design on a systems level to effectively turn preparedness efforts into widespread system resilience. So let's first kick off with a table of contents just to give us all a roadmap and orient ourselves. We'll start with defining public health infrastructure in this context, followed by increasing cross-sector coordination, monitoring and evaluating the capability shift, and how after-action reports support preparedness alignment. Finally, we'll tie all of these aspects together to build durable system resilience. So let's kick this off with defining public health infrastructure. So repeated gaps are essentially structural signals. We may be successful at running exercises, but we're much less effective at changing what happens after them. The same gaps surface again and again: workforce strain, data blind spots, ambiguous decision authority, coordination friction, emergency department overload, and discharge bottlenecks. When those gaps repeat, it's not an exercise failure, but rather a structural signal. If exercises consistently reveal the same vulnerabilities, the issue isn't necessarily training, it may be infrastructure design. So today I want to focus on one question. What would it look like if we designed exercises not just to test response actions, but to diagnose infrastructure weaknesses and guide preparedness investment? To answer that, we need to be precise about what we mean by infrastructure in this context. When I say public health infrastructure, I'm not talking about physical structures. I'm talking about the operating models that determine whether response can function under sustained stress to treat patients and promote health during crisis. There are four main infrastructure pillars exercises should deliberately test. First, workforce capacity. So not a simple head count, but actual usable capacity under strain. Things like who's cross-trained, who remains after 72 hours, and where do leadership bottlenecks occur. Second, we're looking at data and situational awareness. So do hospitals, public health, EMS, and cross-sector operational partners share a common operating picture? Is the information timely and accurate enough to drive action? Third, we have governance. So who has decision rights? When do we escalate? How are conflicts resolved under time pressures? Fourth, resource flow. Not how much funding exists, but how quickly allowable resources can move through procurement and contracting structures, and how quickly barriers to delivery of supplies are addressed or circumvented. So what matters is what stress reveals. And that leads us to increasing cross-sector coordination. So hospital strain is often a reflection of system strain. When we stress the system, hospitals are where we see the most pressure accumulates. Emergency departments overload, boarding increases, discharge slows, staff fatigue compounds, and just-in-time supplies diminish. But exercises often reveal the hospitals are absorbing strain generated elsewhere. For example, in scenario 1, we see an exercise introduces a sustained respiratory surge. ICU capacity tightens, skilled nursing facilities and home health agencies report staffing shortages and reduced intake. Medically stable patients can't be discharged, inpatient beds remain occupied, emergency department boarding increases, and elective procedures are delayed. So what the exercise really reveals is not a hospital surge problem, it's a regional throughput problem, where the hospital strain emerges downstream of system capacity. Exercises and real events reveal something critical. Hospitals are the core infrastructure, but hospital resilience depends on cross-sector operational capacity. Cross-sector operational partners, including public health agencies, EMS, long-term care providers, call centers, outpatient clinics, and behavioral health providers, often absorb load or provide essential signals during these stresses. In scenario 2, we see an exercise introduce a surge in low acuity calls driven by lack of information. Communications to the public are slow to roll out as risk is assessed, and emergency departments begin to fill. Ambulances are diverted. Triage for high acuity cases is delayed. And with the luxury of a bird's eye view, we see that the hospital overload was not purely a capacity issue. It's a system routing issue. Poison control centers or 211 lines could absorb non-urgent demand if routing protocols and shared messaging are pre-designed. So what impact would it have if we intentionally expanded exercise with consideration to these system level challenges, and what would that look like? Well, this can be done by running iterative exercises with the correct partners. Each exercise cycle allows the system to define operational dependencies, design coordination pathways, deploy new capabilities, and test whether those capabilities actually work. Over successive cycles, these partnerships form informal collaboration to operational infrastructure. Now, if you look at a real-world example of how the introduction of a new partnership affects system capability, we can look to the COVID-19 pandemic. Poison control centers in the US became behavioral surveillance and risk communication assets as disinfectant calls surged and clinicians sought guidance on potential exposures and quarantine guidance. Poison centers were not newly invented assets. Their existing infrastructure that the broader system had not fully integrated into preparedness design. If exercises highlight opportunities to engage certain partners to maintain services, then preparedness design should reflect that dependency and formally embed key capabilities. If we look at the infographic to the right, we can see how focused exercises with purposeful injections can highlight this cycle of strengthening infrastructure through iteration. And the next question becomes, how do we know whether dependency is addressed before the next event? Well, we measure it. So that leads us to monitoring and evaluation. In this section, we'll discuss how quantitative and qualitative key performance indicators can support aligning preparedness insights with structural development. The critical principle here is twofold. Metrics should inform priorities. If measurement shows that routing delays or governance bottlenecks become structural priorities, then priorities should inform metrics. And if a dependency is high impact, it must have a defined performance indicator, etc. Often we tend to measure activity, but we need to measure change in capability. After an exercise, we might report the number of meetings held or partners engaged or dollars allocated, but those don't tell us whether the system can function under stress. Instead, we need to measure things like time to regional coordination activation or time to regional load balancing during surge. If exercises reveal hospital overload due to routing gaps, we should measure whether those routing gaps, the speed that increases in the next cycle. If an exercise reveals governance confusion, we should measure decision time under stress. So effective evaluation transforms exercise findings into system insights. So how do we leverage exercise outputs to strengthen workforce capacity, data and situational awareness, governance, and resource flow to advance preparedness alignment? Well, in this vein, after-action reports are not documentation tools. They're prioritization tools because they tell us where the structural weakness exists. And the question becomes, which of these findings are high-impact system dependencies that must be addressed before the next event? This is where preparedness funding enters. So not as a crisis reallocation, but as structured alignment. The sequence we're highlighting looks like this. Exercise stress is applied, dependencies are revealed, capability gaps are measured, priorities are identified, and preparedness investment is aligned. So once these dependencies are detected and after actions are produced, partnership building can begin, governance and funding can be structured to strengthen operations, investments can be systemically ingrained, and new exercises can then be developed to test the updated system. For example, if an exercise reveals that an emergency department overloads because no formal surge routing pathways exist, the measurement shows a 48-hour delay in integration. That becomes a priority finding. Preparedness alignment in this case might include pre-designed surge contracts, standing MOUs with cross-sector call centers, governance updates that include those partners and incident command, not really because we want broader inclusion, but because the operational dependency requires structural integration. But how do we make that system durable? Preparedness funding should be designed should design these pathways so that during a crisis, activation is administrative and not improvisational. This is not about shifting money between sectors during an event, but it's about ensuring preparedness investment reflects how the system actually functions under that stress. To increase accountability, after action should not close until one of three things occur. A preparedness pathway is identified, a responsible authority is named, the finding is intentionally deferred with justification. To enable the detection of trends and communication efforts, measurement and priorities should be structurally linked as follows. Metrics inform structural priorities, high impact dependencies have defined metrics, and these priorities drive funding, governance, and partnership design, etc. When the structure holds, we see that exercises stop being events, after action reports become design inputs, preparedness funding reflects operational reality, infrastructure performs predictably under stress, and infrastructure performs predictably under stress. Otherwise, we're documenting fragility without correcting it. So what happens when we put these pieces together? When we begin building durable system resilience. When we prioritize and operationalize structured partnership development, effective M&E, clear governance architecture, aligned resourcing, and institutional knowledge management, we create a protective effect within the system that reinforces our ability to maintain functionality during a surge. Exercises are one of the only moments when hospitals, public health, and cross-sector operational partners sit together under simulated strain. That moment is truly diagnostic. It reveals where partnership is operationally necessary, where friction slows decision-making, and which pressures destabilize capacity. But institutional memory, as many of us know, can be quite short. Leadership changes, trained personnel leave, and people who learn the lesson in the last cycle may not be there for the next cycle. If insights remain informal, or live only in after-action reports, they disappear with turnover. Resilience cannot depend on who remembers what happened last time. It must be designed. Purposeful exercise design is not about proving we can respond. It's about building infrastructure that performs predictably. And when after-action findings are backed by unified understanding and data, they become design inputs rather than documentation outputs, and exercises stop being events. They become mechanisms for durable system resilience. Thank you.
Well, I think it's really exciting to have both of you here to kind of highlight the fact that emergency management can learn from each other, even if we aren't all working in the exact same setting, because there's certainly overlap in all the best practices when it comes to exercise design and execution, and then the follow-up improvements. Before I get into too many thanks, we'll do the thanks at the end, and I will jump into questions for you guys. We had somebody right off the hop ask a question about how much of an exercise is focused more on business continuity versus focusing on emergency response. And I would say from my own experience, that's one piece where it feels like we're testing our emergency response plans. As you said, I think, Victoria, like we're not supposed to be testing the plan as though it's the plan is check, 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 check. Great, we did our job. But recognizing that it isn't just about response to an emergency. So is there any thought here as far as how you folks strategize between exercise, looking at that continuity of operations versus the traditional emergency response focus for exercise?
So there's a few ways to approach that. Here at the airport, we tend to do, we created what's called the multi-year training and exercise program, MyTEP. So we created it as a progressive exercise plan that starts at the introductory level for the first year. And that it still encompasses everything from tabletops to functionals, but you're using introductory topics. So that can be something as basic as an emergency response to an aircraft crash. Or it could be a very basic testing of your succession plan. You're really not as limited as you think you are on topics when it comes to exercises. So my recommendation is organizing throughout the year. Okay, so this exercise is going to be business continuity focused. We're going to test a succession plan. We're going to have our leadership went to a conference and they all got food poisoning. And now we have to run surge operations without any leadership input, things like that. And you can then progress into, other topics throughout the year. I always recommend doing multiple exercises per year. Don't limit yourself to just one, because you're not going to be able to get that full gambit of everything that you need to be testing. And certainly, we do have agencies with kind of myopic view of, okay, we only test emergency response. No, there's so much more into emergency management. Business continuity is a huge emerging field in emergency management that we need to be making sure that we're touching on. So going then into that second year of more intermediate, now you can combine your business continuity with your emergency response and how those interplay together. And then you can go into advanced in that third year and have more complex exercises that encompass multiple topics at the same time. So you're also, if we think about general turnover, it's usually a couple years. So, you'll have people that can go from the foundational all the way through the advanced and be able to get that full picture of what you're looking at.
I had previously thought of the question as far as what is the cycle? What does the cycle look like? And now you're already expanding on that. So for some of us, just giving one example from my own organization, whenever one of our major emergency policies is updated, it's done on a cycle of a comprehensive review. That's every 3 years. Then in the first year, when that refreshed policy goes out, there's a certain amount of training that's expected.
Right.
Then by year 2, there's more. And then typically in that third year, also for us, there ends up being sort of an escalation. But this often gets viewed as not so much complexity in topics as you're bringing forward, but often is viewed as, well, there's a drill, now there's a tabletop, now there's some sort of functional exercise. And now we don't have to worry about any more functionals for a bit because we've got that one in, we're on to something else that's been updated, and it gets a drill and then it gets a tabletop. So I'm curious a little bit because you discussed in your presentation, Victoria, about the different modules.
Mm-hmm.
Do you view that as all happening in the same day? Is that what you would spread out over a period of time? What do cycles look like in a little bit more detail? And then also, I suppose Larisa can jump in and give some feedback on what you think is a valuable exercise cycle.
So it's a flexible system. The modular system that I put out there is very flexible. It really depends on what you're wanting to test and what type of resources you're willing to put into testing it. So, you can do 3 modules within one exercise. We typically do that here for our tabletop exercises. They're pretty comprehensive. They're like 5 hours long. And so we'll break it into the modules. So we also get the different stages of the incident itself that we get to work through, both the initial response, the sustained operations, and the recovery. But you can also break that into, as you said, a drill, a tabletop, a full scale, or a functional. Use that module 1, the initial response, as your drill. Use module 2, the sustained operations, as your tabletop. Now you're discussing how we're going to sustain operations during a prolonged, protracted event. And then you can exercise the recovery portion during the functional exercise. So it's really scalable based upon your agency needs, how many resources you're able to put into it, the time constraints that you have. I don't want anybody to think of this as some very set rigid model because that's just not how emergencies work. They're very flexible, they're very fluid, and we need to be looking at our exercises in that same way.
Yeah, Larissa, I was going to say, I see that you're also unmuting too to kind of address this, but I also thought it might be valuable to ask you to tap in on when is a good time to get some of those external partners involved in the exercise cycle as well. So I'll put the microphone over to you.
Yeah, thank you, Misha. I think, getting external partners involved really is very situationally dependent, as Victoria highlighted. I think one of the most important things that you can do is align your exercise cycles with strategic planning cycles. So when do budget allocations come due and when are they, coming out? Are there supplemental appropriations that can be accessed for these kinds of activities? So it really is just situationally dependent on your organizational needs.
Now, somebody put in the chat, now this is a fairly long message, so I don't think we're going to end up answering all of it at this exact point in time, but one of them was a question that I wanted to ask you, and they touched on it, which is the incorporation of some of the new technology. So I would say things like including AI assistants. People will use 3D printers and drones and, pull ArcGIS up on the screen and all sorts of things like that. So it gets viewed as a little bit flashy, perhaps sometimes, but anything that can help and anything that might actually work as a cost savings, we're always curious about. So what's new? How does the tech get involved? Any feedback on incorporating those new kind of tech tools into our exercises?
Yes, and that's something I have harped on here at the airport continuously. I think to the point of annoyance for some of my leadership. We've used 3D printing here. We've created miniatures to be able to move resources on the table to show where things have been deployed. We've used AI integrations to assist with scenario iteration, documentation development. And ArcGIS is a great one if you want interactive maps. There's so many ways that you can go about that. And I really don't think they're flashy. To be completely honest, they're useful. They're giving people more of a visual of what's going on, as opposed to just a basic just discussion where nobody can fully picture exactly how everything's playing out. I did see that full question. So to kind of touch on some of what they had said, particularly about time constraints and being able to maybe have virtual options for large scale things. I've seen a few different technologies coming out with that. If anybody follows Robert Henley, he has a great platform for doing virtual tabletop exercises that you can have a larger scale exercise without having to deal with the space. And it also assists with the note taking of the exercise itself. So you can actually have a more comprehensive after action using an AI agent to be able to get your findings. I have also seen a video game coming down the pipeline that introduces a concept for basically agency-wide response that can be done remotely. So everybody in their offices being able to interact through a crisis response scenario and actually being able to work through that process. So that's another thing that I think could be particularly useful for agencies, especially when they want multi-agency coordination. They can have everybody hop onto this sort of open world concept and be able to play that back and forth. So there's definitely a lot of things that are coming down the pipeline for AI that are going to help with budget constraints. They're going to help with time. They're going to help with personnel and make our jobs easier as exercise facilitators, as well as being able to add maybe some more complexity in areas that we otherwise wouldn't be able to touch on without that technology.
Larissa, I've got a question for you. So if exercises, based on some of the points in your presentation, are used as the diagnostic tools for infrastructure, How should organizations incorporate those findings into their kind of strategic preparedness planning rather than just treating them as that kind of lessons learned? I loathe lessons learned.
I understand the sentiment, but I love lessons learned. I think the issue that most of us run into is that we don't focus our lessons learned on what happens more than just the after action item. It has to be more of a system-wide, organizational-wide solution that we're looking at. So we identify the problem, we learned the lesson. Now, what are we going to do about it? So I think the question that folks should be asking themselves in that vein is the dependency structurally supported? Is responsibility clearly assigned? Our capabilities resourced within the preparedness plan. And a lot of that depends on metrics and how we're actually measuring that, as I mentioned. One of the other issues that folks run into in this vein is that they're using either too many metrics or metrics that may be easier to measure, but don't tell us as much about what the system is actually doing when we apply stressors. So I think the opportunity to map priorities in conjunction with partner priorities using these metrics that funnel up from the actual programs into the overarching strategic planning of the organization. So when you're drafting and developing out those goals and objectives, how does that all flow together? I hope that helps.
Well, this also ties into the challenges I think that sometimes we have when we get to the conclusion of our exercise and we're debriefing and we're trying to get those kind of formal reports together, because if you didn't document it, it didn't happen, as the old expression goes. So you want it written down somewhere. But I guess I would just open a little bit of the floor to either of you to sort of discuss how you would actually pull together your debriefs and your reports, because it's, different with different organizations. Sometimes teams have very specific preferences on how they like these things done. We have a 1 hour time slot at the end of our exercise. We huddle for a bit. Absolutely everybody's in the room, and one person takes off to go write the report. We'll review it later and sign off. And so obviously the dynamics of what your debriefing is like, how you approach what those original objectives were, and if they were met. Fill me in on what some of your preferred strategies are for debriefing and getting those after action reports pulled together.
So we do a 3-part debrief here in Atlanta. We do the 1 hour hot wash at the very end of the exercise where everybody's still in the room. We have all the participants, have the evaluator stand up and give their initial findings that they observed throughout the exercise. Let the participants speak their piece about things they noticed, frictions that they were encountering. And then afterwards, we as an emergency management team have our own internal debrief where we discuss the exercise, we discuss some of the things that the evaluators brought up, and really have an open, honest evaluation of how we think things went, because ultimately we're in charge of the after action. So being able to get that team debrief there. And then we do a third debrief among the exercise planning team, because that usually incorporates people from our other business units throughout the airport. And really be able to go over, okay, because this is leadership tends to be involved in those planning exercises. So they get to give their honest evaluation as leaders of, okay, this is where we really saw a gap that we need to fill. There was this piece in the exercise design that really didn't facilitate what we needed to facilitate with this objective, and being able to really have those discussions. So we get 3 phases of it that bring in all different perspectives. And then we go bring that back in for the after action evaluation. We also do a online form for participant feedback, so everybody can anonymously give their feedback. People are very honest when it's anonymous, and being able to incorporate all that in as well. And then usually I will sit down and just bring all that together. not just with an after action, but I also run analytics on the side to show our performance across exercises and across hazards. So taking all of the scoring that we had from our evaluators for each objective and putting it on a scale of 1 to 5. Very easy scoring, very, very simple to process. And basically say, okay, you know, for this exercise on this date, we performed at a 4, a cumulative. And then when we did this exercise last year on this date with the same topic, just, you know, some slight variations, we performed at a 3.5. So now we've seen that we're actually starting to get that improvement across as well. And we can break that down by hazard type. We can break that down by exercise type. Do we perform better at tabletops than we do at full scales? Compare it against your after actions for your real world incidents. And say, okay, are we performing better in the real world than we are in our exercises or vice versa? So I really think taking that extra step into the analytics is really important when we're wanting to eventually implement changes, because now you have the data to back it up, not just a bunch of narratives.
Larisa, I was going to say, I love that, Victoria. Larisa?
Yeah, to build off that, thank you, Victoria. I think there's, you know, a couple different ways that we can go about quantifying that kind of feedback when we're developing out our after actions. One strategy that I really am fond of is using a qualitative data analysis and mapping themes to produce more insights about what actually came out of that exercise. The second thing that Victoria touched on that I really find very useful as well when we're trying to manage expectations of different stakeholder groups is using that anonymous feedback, but then going back and having a conversation with those same participants. But instead of having everyone voice their opinion, you know, in the moment, we talk about that anonymous data rather than having one person feel like they have to speak up or the issue won't get addressed.
Now, this is great because this actually ties back to part of the reason why I was trying to outreach on this topic in the first place and get some speakers on the session. Was I had seen something that Victoria had shared about we have a habit sometimes of trying to be too polite. And so you don't want to ruffle anybody's feathers by showing that we didn't do as well as we thought we were going to, because kind of to the wording from earlier, they get viewed by many folks as it's supposed to be well rehearsed. And so people get very uncomfortable when things weren't going according to how they assumed it would be, the rehearsed kind of format. So any way to incorporate kind of that anonymous feedback is something I agree with both of you. We need to be able to have that as an outlet. And then I appreciate your point as well, Larissa, about the qualitative side, because sometimes perception is more important than reality if we aren't addressing it. So if folks feel that things could have been handled differently, or they felt unsure or didn't have confidence or those sorts of things. I'm not sure if that's exactly what you're taking away by saying the qualitative on it, but I view a little bit of that as being how did people actually feel, because that will certainly influence, you know, what their response experience would be in real life. Any thoughts? Did you want to expand a little bit about the qualitative side, Larissa?
Absolutely. Yeah, I think part of it is reflective of kind of where you're going with it, Visha. But I think the other half of it is uncovering themes that are either quite strong in participant feedback or uncovering themes that no one else has uncovered. So when we map those qualitative themes from participant feedback, we're really looking at, all right, what is something that everyone agrees on versus where is there a divide between maybe one subsect of partners and another, things in that kind of nature.
Now, there was also a question that got put in the chat, and maybe they can expand on it if it doesn't come across as clear for either of you ladies to be able to address. But it was, do you apply some of these same processes used in your exercises to learnings identified from actual incidents. So I was viewing this as perhaps what did you take away from an incident recently, applying it to some sort of safe space to run through the scenario again, but maybe you might be interpreting the question a little bit different. Either way, feel free to answer as you see fit.
So I see kind of both sides of that, both the applying a real world incident into an exercise and to run through it again, but also as a kind of how I was discussing of using those analytics and treating your after actions almost identically. So use your same templates, do whatever you need to do to incorporate and make sure that you're analyzing both your real world incidents and your exercises the same way. And that's what I've started integrating here is we have basically almost identical templates, just, the verbiage is a little different based upon the fact that it's a real world versus a after action, and still having those same scoring mechanisms and saying, okay, this is where, based on all of the feedback that we had, because we run after actions as well we run hot washes and debriefs as well for our real world incidents, and taking all that same feedback and saying, okay, hey, this is how we're performing in this real world exercise. Because then you can go back and compare and actually be able to quantify, did the exercise lead to better performance in the real world incident? Because I feel like that's a big gap that everybody misses, is how do we actually measure, did the exercise help? Because there's really no point in running exercises if you're not trying to measure performance improvement in the real world. So that's kind of where I see that parallel, is trying to make sure that you're quantifying them in a similar fashion so that you can actually compare across the board.
And to expand off that, Victoria, I think it's important, especially in hospitals and healthcare, we often see issues at the regional level rather than in one specific hospital or healthcare facility. So sharing that data with your partners is essential to make sure that you're speaking the same language, especially when it comes to qualitative and quantitative metrics. Again, tying back to having shared priorities, or at least priorities that map to each other. We all want to be speaking the same language when our systems are so intertwined.
Yeah, actually, that's a really good point that you just brought up, which is the thought of how are we actually sharing what our findings are internally and externally. I've worked in industry outside of healthcare where folks keep things very close to their chest about any sort of key takeaways from exercises that they have completed. I find that healthcare tends to be much more generous within the peer networks of trying to express some of those findings that we want our regional partners or peers within healthcare emergency management to kind of make note of. But what are some of those practices that you have as far as sharing the information either internally to the rest of your actual staff and your immediate employees, as well as making sure that the information is getting out to relevant parties?
I think when it comes to sharing information internally, having a robust knowledge management system that makes information, after action reports, data accessible is really a key infrastructure design when it comes to organizational operations. In terms of sharing information externally about how either the response went or you're looking at your data and these are your findings, I think publishing reports and having communities of practice where folks are able to get together and discuss the challenges that they faced and crowdsource solutions is one of the most effective ways to do that.
I know said it better, Victoria.
So for us, aviation does sort of have that close to the chest sort of mentality. And a lot of that comes from federal regulations. So it can be very hard to share certain data because of the fact that we are federally regulated by multiple agencies. So there's some security concerns that can go into that. But ultimately, internally, we make sure we run through meetings and the after actions, and we share those findings across the board. And then for external, there's a lot of working groups among airport emergency management, particularly with AAAE, that we get together and we share those lessons learned. They might be a little more distilled, but we do have that space where we can get together as emergency management and say, okay, hey, we ran into this with our exercise. Is anybody else having this issue with their airport? And being able to really talk through that in kind of a nice enclosed space.
I feel like ending by talking about how do we share and how do we continue to connect and learn from one another is a good place. But do either of you have any final thoughts before we wrap up the session that you'd like to share with the audience?
I think the one thing that I really want people to take away as exercise facilitators, especially, is we really need to get comfortable with being uncomfortable. And because that's the only way that we're going to actually have substantive change. So, I don't necessarily mean be confrontational, but be confrontational. Be honest with your findings, be honest about how things went, and don't be afraid to introduce consequence into your injects to be able to actually drive that critical analysis of, are we doing things the way we need to be doing things?
I would agree, Victoria. I think, being too polite is one of the issues that we run into. So finding ways through metrics and priorities that kind of remove some of that pressure is also another avenue that we could leverage to make sharing information and just running exercises to support systems a little bit more sustainable.
Well, Victoria and Larissa, I really appreciate you joining us. I think there's some great takeaways that apply not just to healthcare, but to anybody that's working in exercise design to try and improve the resilience of their organizations. These sessions are recorded, so hopefully even more people than those that attended are able to use this as a tool to enhance their own programs. So again, really, really grateful, Victoria and Larissa, for your participation today. And if Ali's still on the line, I can turn to him to close us out. Otherwise, I don't mind. I see you're there, Ali. Over to you.
Thank you very much. This was really great presentation. Thank you for sharing your experience and your expertise here with the group. Everyone was impressed with the amount of knowledge shared here in this 1 hour session. Thank you, Misha, for moderating this. Thank you, Victoria and Larissa. Looking forward to future sessions like this. We will continue this speaker series in April. And it's not fully planned yet, but it is in progress, and we will inform you as soon as it is set. Thank you again, and have a very good rest of the day.